Welcome to week 9, module 9. I'm going to share my screen here. Okay, so we'll be covering Giddens, chapter 10. Here are the learning objectives, so be familiar with all of these learning objectives. And also, as you're studying, make sure you cover all of these learning objectives as well. So make sure you're studying, demonstrate written, verbal communication, teamwork and collaboration, delegation, discuss the concept of development, right? Because remember, we will talk about from beginning of life all the way to death throughout all the concepts. So be sure to apply that. And then you'll be able to describe concepts of thermoregulation as well. Okay, so this is thermoregulation, and the definition is the process of maintaining core body temperature at a near constant value. Also, make sure you look at figure 10.1 in your text as well. So hypothermia really is any temp below 97 Fahrenheit or 36.2 Celsius. Hyperthermia is any temp above 37.6 Celsius or 100 degrees Fahrenheit. Normothermia is between 97.1 and 99.9. And just remember, the hypothalamus establishes a set point, meaning the temperature level for optimal physiological function. And this is actually a negative feedback system where thermoreceptors, peripheral and centrally, located throughout the body, send info to the hypothalamus, which responds by increasing or decreasing temperature using the endocrine and the sympathetic system. The hypothalamic set point for core body temperature is 37 Celsius or 98.6 Fahrenheit. So that's important. There are compensatory and regulatory actions which maintain a steady core temp when a person sits, stands, walks, or runs, digests food, or even changes his or her respiratory rate. Regulation is a body function, and it helps the body compensate that. Be sure to look at figure 10.2 as well. The body heat, remember, that figure was 10.2, sorry. So body heat is continually produced through metabolic activity by chemical reactions occurring in the cells. The greatest amount of heat is produced by muscles and through metabolic activity in the liver. So that's important as well. So metabolic activity involves the ingestion and metabolism of food and the basic metabolic rate. The body conserves heat through peripheral vasoconstriction. This process shunts warm blood away from the superficial body tissues and skin surfaces and increases the muscle activity to minimize heat loss. Not only does the body continually produce heat through metabolic activity, but also it continually loses heat as well. Heat loss occurs as a result of multiple mechanisms, including radiation, conduction, convection, vasodilation, evaporation, reduced muscle activity, and increased respiration. Heat loss to radiation occurs through a process of electromagnetic waves that emit heat from the skin surfaces to the air. Infants, children, older adults, and cognitively impaired and homeless people are at risk for hypothermia. So that's important to note. So see box 10-1 for medical conditions that increase the risk of hypothermia. Primary prevention means are, clothing, temperature outside, shelter, educating people, about how to reduce the risk for hypothermia or hyperthermia as well. So that's all primary prevention. And then we're going to go to the question for the week here. So make sure you put this on a Word document and submit this. And here are the learning objectives that you should understand. Okay, so so be sure to look at the nursing intervention strategies for both hypothermia and hyperthermia. So for hyperthermia, you have remove excess clothing, right, and blankets, provide external cool packs, provide a cooling blanket, hydrate with cool fluids, oral or IV. You can lavage with cool fluids through an NG tube, and you can administer antipyretic drug therapy as well. So again, primary prevention. So every concept that we're learning about, always make sure you're including primary prevention, which some examples are, smoking cessation. Let's see, what else? Vaccines, immunizations. So always look at the primary prevention. So clinical management, primary prevention for regulation, thermal regulation, is avoid exposure to temperature extremes, maintain the optimal ambient temperature in the home, dress appropriately for the temperature, engage in physical activity appropriate to temperature condition. Okay, and then intervention strategies for hypothermia is you want to remove any wet clothing, right? Remove the person from cold, provide external warming measures, provide internal warming measures as well. And then the safety tip is core rewarming must be done slowly to minimize the risk for dysrhythmias. So cardiac monitoring is required when the patient is recovering from severe hypothermia. And then kind of apply it to the interrelated concepts. So thermal regulations can be applied to infection, intracranial regulation, perfusion, tissue integrity, nutrition, and fluid and electrolytes as well. And then some exemplars that you should focus. So these are application questions: fever, malignant hyperthermia, heat stroke, and then remember, we're covering infants all the way to death. So preterm and newborn hypothermia. And you guys had on exam 2 an exam question on how to prevent cold stress, right? So be sure to review that as well with hypothermia. And then there's also environmental exposure regarding to hypothermia as well. All right, email me if you have any questions. This completes Module 9.